Think you know everything about diabetes? What if I told you that some of what you've heard might be totally wrong? Stick around, because today I'm exposing the top 7 lies about diabetes that everyone needs to know. As a doctor, I have heard lots of myths about diabetes from my patients, and the worrying thing is that believing some of these myths affects the management of their diabetes and brings about guilt. Hence I made this video to debunk these myths and present the facts to you. So let's dive in. The number 1 myth is one of the biggest lies they tell you about diabetes. In short, the food industry is relying on this myth to sell their products to you. This myth is that diabetics need special foods. They market things like biscuits, cakes and chocolates specially made for diabetics, claiming they are sugar-free. The truth? There is no such thing as a special diabetic food. In short, anything labeled for diabetics should be avoided, as they offer no additional health benefit to the buyer and they are generally more expensive. Also, it's been found that some of the artificial sweeteners used in these products as sugar substitutes can impact on insulin sensitivity, making it more difficult to control your blood sugar. It can also mislead the buyer to think the food was essential for them. The truth, on the other hand, is that people with diabetes are advised to eat healthy, balanced diet just like everyone else, and we would be discussing the nitty-gritty of what constitutes a healthy diet for diabetics in our next video, so keep an eye for that. Myth number 2 is no one in my family has diabetes, so I won't get it. Now, it is true that having a family member with type 1 or type 2 diabetes increases one's chance of getting diabetes, as family history is an established risk factor for diabetes. However, many people with diabetes have no close family member with diabetes. This is because diabetes is a multifactorial disease with a genetic and environmental component. Factors like obesity, sedentary lifestyle, poor diet, can all increase the risk of diabetes even in the absence of a family history. So not having a family history of diabetes doesn't make one immune to diabetes, and living a healthy lifestyle is still very important. The number 3 myth is that people with diabetes can't eat sweets or chocolate. This very common myth often leads to unnecessary dietary restrictions and guilt. People with diabetes can enjoy sweets and chocolate in moderation. The key is to balance them as part of their overall healthy meal plan and keep track of their blood sugar levels. It's all about moderation and not deprivation. Myth number 4 is that type 2 diabetes affects only fat people. This is untrue, as about 20% of people with type 2 diabetes have normal weight. Agreed that obesity is a risk factor for diabetes and diabetics are encouraged to lose weight as part of their management. However, it is important to know that not being overweight or obese isn't enough to prevent diabetes, especially if there is a family history or if the lifestyle isn't healthy. Myth number 5 is that you can eat anyhow whilst on diabetic medication. Now, this can sound true on the surface because you would expect that your medication will keep your blood sugar in check. However, this isn't true. Regularly eating unhealthy food or oversized portions of food may prevent the medications from doing its job and can make the blood sugar control more difficult, predisposing one to the complications of diabetes. Medication, together with healthy lifestyle choices, is needed for a better management of diabetes. This next myth seems to be the commonest one I've heard about diabetes out there, and that is that eating too much sugar is what causes diabetes. The truth is that whilst eating a lot of sugar isn't great for your health, as it can lead to obesity and is not generally good for your health, it doesn't directly cause diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system attacks insulin-producing cells. And this insulin is needed for blood sugar control. Type 2 diabetes is more about how the body responds to insulin and is often linked to genetics, obesity, and a sedentary lifestyle. So, it's not just about sugar, folks. So the next time someone says their diabetes is due to having eaten too much sugar, tell them it's much more complex than that. It's not just a sugar problem, but an insulin problem. The 7th myth we'll be talking about today is that insulin cures diabetes. This is a huge misconception. Insulin is a vital treatment for people with type 1 diabetes and some people with type 2 diabetes, but it's not a cure. It's a way to manage the condition and keep blood sugar levels in check. So far, diabetes has no cure. However, managing diabetes with the right medications and lifestyle changes guarantees a healthier and happier life with diabetes, with less chances of common complications associated with diabetes. We have talked so much about the myths about diabetes today, and it will do you well to have the right information about diabetes rather than these myths that abound. So please check out this video that appears down below on the symptoms of diabetes, as this will help you better monitor your diabetes and pick up complications early on. If you found this video informative and valuable, please consider subscribing to our channel for more insightful content on health and wellness. Don't forget to like this video and share it with others who may benefit from learning about diabetes. Your support helps us continue to create engaging and informative content for our community. Thanks for watching.